Give you a better answer on that, but yeah, that's how it goes. Now, once you're finished, you may notice certain changes as well, but I do want to make sure to emphasize that perimenopausal is not where you're having more periods. It is irregular, but it's not having more periods. If you notice that you're actually having them more frequently, there probably is something else that's going on. And I want you to be mindful of that, because that may be a sign that something else has changed. Maybe your hormones have changed. There may be what we call uterine fibroids, or basically benign tumors that are in the way and are bleeding. So those are things that you may need to get evaluated. So be mindful of that. And then once you're finished, then you're postmenopausal. But just like how they say about acne going away when you are no longer going through puberty, it's a lie. You still can get hot flashes afterwards. Now, it may not be as frequent, it may not be as intense, but it does still happen. So unfortunately, there's no rest for the weary. Now, typical age between that is about 45 to 55. Now, anything less than that, you may say, oh, my mom, she stopped at 40 or something else happened. That's still considered premature ovarian failure. So if that happens, you need to see a doctor, because there are a lot of factors that you see down there. Genetics, health conditions, lifestyle choices, a lot of different things that can happen that can cause you even surgery. But if that happens, remember, those hormones that we'll talk about here in a second are important for brain health, bone development. And if you lose those early, you may have to talk about hormone replacement therapy to reduce your risk of osteoporosis. So those are things to consider. Now, some other things, kind of keep in mind, misconceptions, things to expect. It doesn't mean that you're going to be absolutely miserable. But it also doesn't mean that it's not necessarily going to be comfortable when you go through menopause either. So there are a lot of things to expect that you can have happen, but it doesn't necessarily mean that it has to be the end. One thing I commonly hear is that's the end of sex. No, it's not. It doesn't have to be that way. There may be some things you have to change on how you do it, but it doesn't have to be the end of those things. And those are still very important parts of relationships. So I don't want you to think like that's the end of things. Other things that kind of keep in mind, it's a difficult conversation for a lot of people. Some I've even had that are embarrassed by it, but it is something that's important to talk about, because, like I said, there are certain things that you may hear that's actually not okay. So you may need to get help to prevent something in the future. So some things to expect, but again, not limited to. Doesn't mean you're going to get every one of these, but things to expect. Now, these hot flashes, night sweats, yeah, it's not like I'm a little bit sweaty. It's like someone turned a furnace and blew it at you. That's what that often feels like. It can definitely make you sweaty. You can feel, even in a cold room, you may even wake up, have to have the fan on. Your significant other may even complain about being frozen while you're feeling hot, and it is what it is. But that definitely can happen. Now, it doesn't always have to be that way, but it certainly can. Some other things, they may, like I mentioned, vaginal dryness, that definitely can happen. So that may be where you have to talk about either some hormones to help with that. That may have to, that would be like creams. That you may also talk about things like Astroglide, things like that to be able to help with that. Other things, like I said, mentioned about the cycles that are changing. Those are things to expect. But as far as affecting the quality of life, it all varies. Some other things, actually I have a chair here that's just holding nonsense. It's not even my stuff, if you guys would like that. I'm not even sitting. Here, you bring that back. Someone's going to pass that along. I hate you guys to sit. You guys want to pass that along? Oh yeah, this is recorded, my bad. Alright. Other things to expect, mood swings. Yes, those certainly can happen, especially as you go through hot flashes, lack of sleep. You may have some memory lapses. And some of it is a little bit of memory lapse because you have some decrease in sleep. Some of it can be, though, because you lose estrogen, and so the brain isn't as fully built. Keep in mind, though, it doesn't mean that you're dumb or anything like that. It doesn't mean that you're not going to remember anything. That's different. If you notice you're having trouble with memory even greater, it's just a little bit of like, what did a friend tell me? It was like the why did I go in here kind of thing, where you go into the room and you're like, what did I go in here for? That's kind of what you'd expect. But if you notice the situation where you really are forgetting names, you're getting lost, those are much greater. And again, that would be a concern for things like dementia. But it could also be other things, depression. It could also be a lack of sleep, quality sleep. And those are things you need to be aware of and to be able to get help for. And then there are different ways you can be able to manage those, but ultimately getting help, figuring out what that may look like for a lot of people. We're going to actually talk a little bit more about this, other things. Whenever we talk about there's always some risk of osteoporosis. Now, there are certain factors that can increase your risk. Being a smaller frame, losing your periods sooner. There's a lot of different things. Genetics, small frame. Those things can increase your risk of osteoporosis. That just means that you would have a higher risk of fractures. And for some people, that could be debilitating. That could be ending up in the nursing home. That can be end of life because they're not going to be they're going to have good quality for replacement of their hip, because you may even hear where some people are going to have some type of surgery, but the orthopedist says, man, it's when they try to put a pin in there, it's like going through butter because the bones are so frail. So those are things that I tell people that it isn't something you want to find out you have osteoporosis and then you start working out. It's something you want to start doing right now to prevent from getting there in the first place. Because we talk about and again, I will go over this in a little bit more, but I just want to emphasize this. When you try to start lifting weights, not walking, lifting weights, not every woman's going to look like a bodybuilder. That's more genetic, so you don't have to worry about that. But no, like one friend told me, you're never going to complain about being too strong if it means being able to carry your family out of danger. No one's ever going to complain about that. But the thing is, in these situations, it actually is very difficult for people to regrow bone when they already have osteoporosis. It's much better if you start now to prevent you from having problems later on. Other things, when you lose that estrogen, a lot of times women's risk of heart disease actually is better than men, but losing that estrogen during menopause does increase your risk. It almost makes it pretty close to similar to men already. And we already know what good choices men make already. So the other things, same thing when I talk about with working out, those metabolic changes. When I talk about metabolic changes, it's about the hypertension, the high blood pressure, the high cholesterol. Those are warning signs that you have something else going on, and you want to catch those early. And so the being able to catch those early will prevent you from having problems later. And you don't want to wait till it's already a problem. So certain things that you can be able to do. Some of it may require tests. A lot of times when you are questioning whether you had osteoporosis, or menopause or not, you don't actually have to have blood tests every time. Now there are certain situations where we would, but most of the time it's just based on whether you've gone 12 months without a period. And another thing I want you to be mindful of, let's say you've been 12 months without a period. Maybe it's been 13 months, 14 months, and then you start bleeding. And you're like, well, no, I just started over. Not necessarily. That can also be a warning sign of endometrial cancer. So keep it in mind, like if suddenly you've been period-free for a long time and suddenly you start bleeding again, that's a warning sign. So don't sit on that. A lot of times that I may need to do blood testing and say, let's say you had an ablation where they scar up the uterus because you already had other issues. Maybe you had your uterus taken out already. Those would be signs. You may have signs that you're having hot flashes, but you're not really sure, is this or is it not, because you're not having periods. That'd be a time to get blood tests, because then you can know for sure, yeah, this is exactly what's going on. And then with that, people always ask me to draw estrogen. There's usually 4 or 5 different forms of it. It ebbs and flows throughout your day, those different forms. Usually your LH and FSH, your signals from your brain, is actually what I need to see. And those would be high because we're not getting estrogen for that negative feedback loop. Don't worry about that part. That's not on the test. I already mentioned this other before, just talking about your risks, talking about other things. Again, just keeping in mind that your cardiovascular health and your bone health are very important. And the ways you can be able to check those are bone density scans. That's just kind of like an x-ray. They check how dense it is. Insurance will pay for it if you have it, if you're at 65. But if there's weird fractures that you're like, someone comes in and they say, yeah, they broke it, they weren't really doing anything, then I may go ahead and see about if I can get that approved, because it seems a little weird. Especially if someone has risk factors that they stopped having periods at 40 or something like that. Those are things that I would want to check early. Other things with the cardiovascular health, getting regular screens, getting your blood checked. But cholesterol, I gotta say this as a warning sign. Sometimes cholesterol is a weird thing. There's a lot we still don't know about. So just saying, okay, maybe you've got a, this is usually I see in men, so that's, but I'm gonna say that later on. Usually you get a good blood test and you were eating like crap all before, then you're like, well, I can eat whatever I want because I'm good. That's not necessarily true. You do want to be able to take care of yourself regardless of what the labs show. Otherwise, we have different ways we can determine someone's cardiovascular health. You hear about doing the body mass index, you talk about 25 or higher. That one's not always as accurate. There are different ways you see people doing it. You see, like, they'll do like the in-body scan, that they'll do it like at some of the superstore, and like the YMCA, they offer those. You'll see the skin test. There's one where you can submerge someone underwater. That's not for me. That's like, it's a little bit too much for me. The one thing they do in some countries is the waist to hip ratio. Now the waist to hip ratio basically means that you're measuring from here and then from here, and then you divide it basically. And if you're greater than 1, that means your risk of diabetes, heart disease are higher versus someone who has a lesser number. Because some people, they actually carry their fat like their thighs or wherever else, and we found that that is not as high of a risk factor for than other areas. And so specifically the fat we find here is what increases your risk of diabetes. And so, because they consider that more the unstable, so it's going to dislodge into the vessels, the muscles, create insulin resistance, that kind of stuff. So things you can do about it. Again, emphasize it again and again. Exercising, exercising, exercising. And it doesn't mean, no matter what, find something you like to do. But then also, do it with others. Because if you do it to yourself, you can convince yourself, like, I'm tired, I'm not going to go in tomorrow. Or, I did this, I deserve this. But if you have other people to keep you accountable, it can make a big difference. Because you know, like, oh, this person's waiting for me. This person, I told someone I was going to be there. So it's much harder to lie to someone else or to a group of people. The main things to focus on, 150 minutes of moderate intensity exercise, or 75 minutes of high intensity per week. Or what someone said was, if you can, if you can sing through it, it's moderate intensity. And if you can talk through it, or excuse me, if you can sing through it, it's low intensity. And if you can talk through it, it's moderate intensity. If you can't do anything because you're puffing and puffing, it's high intensity. So those are things to think about. And then again, I still emphasize 2 days of lifting weights. Doesn't mean you have to lift extremely heavy. Doesn't mean you have to try to be a bodybuilder or anything like that. But some type of resistance to ensure that you're pulling on those muscles, to pull on those bones, to cause stress on the tendons, so that you ensure that it actually causes more calcium deposition into the bones.
With the weightlifting, would you include that with like push-ups and planks and,
right,
and some other resistant type?
Yeah, planks are a great example of a full body exercise. My only thing with push-ups are fun. I get that. Bench press is fine. It helps. Sometimes though, you can have some of these guys that are like big, but they still fall easily, and you're like, "What are you strong for?" I'm kidding. It's not. But a lot of it is that functional strength to make sure that you actually have good balance, so that you don't fall. Now, a lot of times when someone breaks their hip, it's actually not the fall, the landing that breaks their hip. It's that poor balance, that twist. Our bones are good for being able to handle strength, and they're good for handling, for bending, but they're not good for twisting. That's why toddler fractures happen, because you twist, they twist in the way, and then the shin bone, the tibia breaks. It's the same with the hip. A lot of times it's, I had poor balance, I planted, and I twist, and that's how I end up breaking my hip. So having that balance to be able to ensure that I can stay upright is helpful. So with some of the workout groups we do is called the old man or old woman test, is where you have to stand, untie your shoe, take it off, take the other one, and then you have to put the shoes back on without actually putting your foot down. So that's kind of the test. So if you can't, if you have to put your foot down, then your risk of falls are high. We can even try it afterwards, but we won't do it right now. This ground's still a little hard. I don't know what liability looks like with the school. Maybe we won't do that. We'll wait till after school. We'll do it in the grass or something. Also, balanced nutrition. Again, don't wait until it's later. Don't wait till you start actually having chest pain. Don't wait till you have your first heart attack. Start taking care of yourself now. It's scary having something happen to you where you think like you have some big health event, something happens to you. It's important to take care of yourself now. Don't wait. Besides that, just stress management. I know that's easier said than done, especially with your jobs. That seems like, oh yeah, absolutely, because I have a stress-free life. No, I know, but yes, we're always going to have some stress, but finding ways to find balance. Because we're always going to have some stress, but finding ways we can de-stress. And that doesn't mean like going drinking all the time, because that's not really helpful either. It just helps you avoid what's going on, but it doesn't actually help you balance in your life. And then good sleep hygiene. I've been accused of this by my wife plenty of times, and so it does mean making sure to take care of yourself, because you may, even exercising, you may notice that if you're not getting enough sleep, you're actually going to plateau pretty easily with your workouts, with your weight loss, because you're just not allowing yourself to heal properly. But don't make that a habit of always doom scrolling and sleeping all the time. You're not going to get anywhere either. So, now things that to kind of consider whenever we're talking about treatments, medical treatments. They're one thing you often see here about hormone replacement therapy, or HRT. You're going to see on here. That may be to help with the symptoms especially, but there may be other things that may be helpful even afterwards. They're usually, just make sure you talk to your doctor, talk about certain things that you may need to be aware of to help prevent other things. So for example, if we talk about your family history of breast cancer, probably not going to want to do hormone replacement therapy just because of that risk, that what if of like you get breast cancer because of the hormone replacement therapy. If you smoke, that is a high risk for having blood clots on hormone replacement therapy. And of course, as well as endometrial cancer for the first part. But those kind of things are important to kind of keep in mind. There are different versions that comes with hormone replacement therapy. There's pills, there's creams, there's a lot of different ways. Most of these are going to be effective for preventing hot flashes. There isn't shown to be an increased risk of one or the other, or there is not shown to be an increased risk of cardiovascular disease when you're on hormone replacement therapy. The only thing I saw was in a smaller study, this is unrelated to this topic specifically, there was some increased risk of hormone replacement therapy for those who were transitioning in genders, men to women with hormone replacement therapy. That was the only thing I had ever seen that was pretty like concrete. So, but that still need to be a bigger study. There's different ways to do it. You just have to figure out what that looks like for you. If you're worried about having some type of cancer, blood clots, those kind of things, there are alternatives that aren't necessarily as good as hormone replacements, but they are better than nothing. Some of these medicines, you have to kind of figure out what one works best for you. It may be some antidepressants, even if you're not depressed. Some of the smaller doses usually help well. Some of these others, the only one that I would say definitely would be soybean products, tofu, soybeans, soy milk, that kind of stuff has modern evidence. And they've shown that with countless studies, it does, even though you're doing that plant estrogen, it does not increase your risk of breast cancer by taking it. And no, if that's only milk you have in your house, it does not mean that men are going to start developing breasts because of that as well. They can still drink it. That's the only thing I get. I've heard several people doing black cohosh as well. There isn't any strong evidence showing that that's been beneficial for helping with hormone or hot flashes. If you take it and you like it, it helps you, absolutely, fine. Otherwise, I wouldn't keep spending the money. Otherwise, just support through these, and that's just support in general. That's not even just support just through this, but support in general. Just knowing that you're not going crazy, that the symptoms you feel are normal, and sometimes you may feel like you're going crazy with it, and that is expected, especially with mood swings and stuff like that. But getting support, educating yourself, empowering yourself through these are helpful to ensure that you can feel normal. Because a lot of times with these changes, it feels like a struggle of feeling normal. Some conclusions, just talking about natural versions, just knowing about knowledge about this, and just making sure to take care of yourself now. That's the biggest things. Those are the biggest things to take home from this. And then shameless plug, if you make sure, just find a place that you work out, find a place that you enjoy. If there's a free group that meets throughout the city, and so if you're looking for free workouts, stuff like that, there's no commitment with those. But yeah, they meet at the Capitol Monday and Wednesday, and also Saturday at 7:30. It is in the morning. I know a lot of people are like, oh, in the morning, 5's really early. Like, eh. For me, it was like, if I stop doom scrolling, it's actually not that bad. All right, any questions while I transition to the next one?
I have a question.
Go for it.
You didn't mention pellet therapy, hormone replacement therapy, pellet therapy.
Yes, thank you for mentioning that. Yeah, it's in there, and so that does seem to work really well. The struggle is there's only like a couple places that do work, that actually do it in Jefferson City. What they do is they actually have a pellet that's actually catered to you about what your needs are, and it just goes into your skin and just releases hormones throughout that time, and then they check your levels, and then they have to replace it with a new one, and they kind of cater it towards that. There's ups and downs with that. It's all self-pay. That's the biggest downfall with it. It is catered towards you. Some of the issue we have is like, if I have a problem with like a complication, a stroke, and I'm not saying this like, don't do it, because it was one time that it happened, it's already in your system, right? So as opposed to if I have an issue, like I suddenly get diagnosed with breast cancer, just stop taking the medicine, right? It's a little bit different. So there's ups and downs with it. It is nice because you don't have to take a pill. It is nice that you don't have to worry about the ups and downs and stuff like that. It's catered really for your needs, absolutely. But that is a decision you just have to make for yourself. What else?
The scales that you can buy for $30 that give you all the stats, do you think they're accurate?
You know, for some I've seen that are pretty accurate. I don't know, you know, they're also like these smartwatches say that they can do it too. I don't know exactly how accurate they are. I think one thing to kind of keep in mind, if it's cheap, right, it's kind of like, if I do just a regular scale, all I know is if I'm lifting weights, it just goes down or maybe it goes up. And I don't know what that means. You could buy one of those, and really if you use it for today, and then you compare it in a month, and you see that it improves, well then that's really what you're looking for. You're not necessarily chasing a number, you're chasing your previous self, and that's really the goal, is just being better than your previous self. So even if it's not the greatest, it wasn't exactly all that expensive either, and if you get like better results, you can at least know that you're going in the right direction. Because like health, we're never focused on achieving health. We never win health. We never win like family. We just know that like it's this long game that we have to play. And there's never this point also where I get to the weight that I want, then I'm in this nebulous period, I can eat whatever I want. No. You continue to strive, continue to be better. Yes, we fall off sometimes, but we continue to improve. And that's kind of what we're looking for. So in those kind of situations, I'd say, yeah, I mean, absolutely. I have nothing wrong. No, nothing opposed to that.
And within the district, we have in-body scales that are pretty accurate to measure your muscle water, body mass index, body fat percentage. So if you ever need to use that, let me know, email me. But we bring those to the biometrics screenings to in-body scales to give you guys a good baseline, and it stores your information on there. So it's asks you to enter your ID information on there, it's your cell phone number, but it keeps it keeps track of your information. So if you use that same scale, you can come back in 1 month, 3 months, 6 months, and revisit that to get an idea of where you're at again. So.
Cool. Any other questions before I move on? All right, we're going to talk about guys. I appreciate you guys being here, because that doesn't happen often. What I was actually planning was actually, most of the time, the reason guys even go to the doctor at all is because their wives made them go. So I was like, all right, well, I'm going to do this anyway, because at least then you can be able to tell your husband, like, hey, I learned this. Tell your husband or boyfriend, like, all right, I learned this. You need to go. And then yeah, then they come to me and go, I don't know. What are you here for? I don't know. She said I need to come. Okay.
Yes.
Super helpful. All right. So, key topics we're going to talk about. Still, we're going to talk about hormones, changes, same thing, only different. Aging, diagnosis, treatment, that kind of stuff. So, it's an overview of hormones. The main things we need to be talking about are testosterone, DHEA, dihydroestradiol, and then growth hormone. Now, keep in mind, with women, there's this estrogen, progesterone loss, during periods. Men, it's not the same way. We actually have a regular release of all of these, but we have the highest testosterone in the morning, and it drops throughout the end of the day. That's just normal. And so the way we treat ourselves, the way we work on things is a little bit different, and the way things may work out. So all of these have some support for our metabolism, muscle growth, and also mood, bone strength, overall physical development. All of them have some level of focus on that. The main thing to kind of keep in mind, our hormone production will gradually lose as we age. Originally, the original studies thought it was at 50, we started losing 1%. It actually had shown more, actually around at 30. We started losing testosterone as we age. Now, it's about 1%. Some may have higher, some have lower, but it actually is a normal progression. Now, there are ways that guys can be able to address that, and we'll talk more about that here in a bit, but those are normal changes. And with that, they may expect to have things like lack of motivation during their hormone shifts. They may have even look like depression because of it being down. And so being able to see your doctor to be able to figure out what is it actually that they're dealing with. Is it because of low testosterone? Is it because of depression? Is it because they're actually having heart disease? And they're actually not even opening up about the fact that, oh yeah, I just thought, I had to face it. They told me, like, I thought it was just normal aging to have chest pain. I'm like, no, it's not normal to have chest pain. That's not a thing. All right, some changes to kind of expect. That's kind of, oh, whoops, sorry, too far. Sorry about that. Things to expect, that's just a normal decline. Like I said, at 30, it affects the muscle mass, have increase in fat deposition, and then with that, the lower testosterone, decrease in libido, decrease in energy. And so those are reasons to maybe consider. But I will say, that's not the only reason that guys would feel that way. There's a ton of reasons. Lack of sleep. Maybe I'm not taking care of myself. Maybe I eat like a trash panda. Maybe I eat whatever that may be. There are different reasons that I could be able to feel that way. So it's not just always testosterone. So within these, you actually have other things to expect, decrease in metabolism, just with the others. But most of it's going to be your driving force, going to be your testosterone. And DHEA is really just a precursor to testosterone. It just serves a place as well, but it's the same thing. Overall, just fatigue, weakness, like I said, the mood changes, sexual drive. And the thing I always tell people, the sexual drive is different than an erection. An erection requires two parts, a nerve and a vascular type of input and output. So that's different than sex drive, where I have the desire to have sex. And one thing, and this is a difficult question to always ask, is I always have to ask them when they come to me and they talk about having decreased sex drive or decreased or erections, is do you like your partner? And that's a hard question to ask, because then you're like, hopefully she's not right there when you ask that. But sometimes it's an honest truth, because you have to face the fact that maybe there's actually issues in the marriage. Maybe there's things going on. Maybe it's something we need to address before you even get to the point where maybe even infidelity. So those are hard questions that we have to have. But those are things to consider. Like, maybe I'm not having erections because I just don't feel the same way about this person. Those are hard conversations to have. That's just the only thing I want to make sure to mention, that sometimes, again, it's not testosterone. And sometimes I actually have a developing heart attack coming, and that's because I have poor circulation, and that's why I don't have erections. That's a whole other thing. Again, not testosterone. Some other things to expect. Like I said, mentioned before, there's increase in fat and loss of muscle. And so definitely things that guys need to be aware of. The other thing to kind of keep in mind, normally, insurance doesn't always cover for bone density scans for men, but men still get fractures. Men can still have these things. There are certain factors that you may have to see your doctor about to be able to get that bone density scan, to be able to catch early before, again, they break their hip or something else. It's because men still can get frail. They can still get to a point where they can't take care of themselves. And then the decline, the main thing to kind of focus on when we talk about this sexual drive, it is, if we do find that that is an issue, that's usually your main reason that we would want to replace testosterone. Because, yes, we know that testosterone is important for muscle mass, for fat deposition, for energy, but a lot of times your sex drive and energy is really the only reason that we give it the testosterone for, not for the other things. Because, and the thing I always have to mention to people is if you don't feel any differently, then it's not worth taking because of other risks that we'll talk about later on. Other things to kind of keep in mind. It's a little bit hard when I talk about mood swings because we think like men don't have feelings or men only have one feeling, which is anger. But we do have other feelings. We just may not know how to express them, and it just becomes like lashing out. But those swings, they have to know that it's not necessarily normal when they feel this way. Depression also, I want to keep in mind, is that depression will look differently depending on the race. So because of previous backgrounds and stuff like that, what that may look like may vary. And so for one who's had well-developed, they may actually be withdrawn. And some, it may look like anger. And so it will look differently depending on the person. So those are warning signs to kind of keep in mind. Things are different. What is it? And it could be just something simple like that. And then cognitive decline, again, that memory, again, you always think like, oh, well, I just thought that was normal to not remember. And to some degree, yes, you age, your brain shrinks, those things do happen. But if you notice, like, again, getting lost, forgetting things you shouldn't, those are warning signs you could be developing dementia. But also for men, there's a difference between poor memory and I wasn't paying attention. So that's another thing as well. That's a whole other thing. I struggle with that as well. That's selective memory. That's a whole other thing. That's not testosterone. That's just because that's me. And selective hearing as well. That's not testosterone. If I wasn't even listening, then yeah. Recognizing these symptoms. So being aware of these things can be helpful, but again, we talk about like these things we have to be able to catch and figure out what that may be. So it may mean for a lot of guys that they come in and say, I feel this, I don't give a pill. I got to figure out what it is that's going on. So that's why those hard questions. And so if you just show up to the doctor and they just give you a pill every time, that may not actually be the right person for you to see. You may need to actually figure out what is the cause of why you feel this way. So there are certain hormones we can check. The one thing I always want to emphasize for people, for guys especially, if testosterone, again, I mentioned how testosterone is our highest in the morning, right? So I don't want to check someone at 4 because the normal levels that I expect should be first thing in the morning. So don't come to me at 4 in the afternoon and ask me to check your testosterone. I'll have you come back later because it'll be low, but then it's like, what do you do with that? And so it's got to be first thing in the morning. It doesn't have to be like 8 as soon as we open the doors. It's going to be in the morning. That's what I expect it to be that way. Common things to kind of measure would be testosterone, but then also checking some other things that might be leading to it. There are tons of other hormones that can affect your testosterone level. And so have an idea of things like thyroid, prolactin. Those are a lot of different things that can cause that. Some medicines can definitely cause that as well. So keep it in mind. What does that look like? Sometimes even certain medications, heart medications like beta blockers for your heart can cause erectile dysfunction. So there's a lot of different reasons that you can be feeling this way. The biggest thing is, like I mentioned before in the previous lecture, catching these things early. Don't let it become a problem. Be proactive. Taking care of yourself, making these changes now, getting good habits now. How long does it take for something to become a habit? It just has to happen frequently enough that it becomes normal. So different medications can also help if it's needed. Also hormones, those are different things. Main thing I was going to mention, these are different ways that you can see about replacement. Some have their place, some have not. It just depends on preference, and some of these are pretty expensive, and so sometimes it can depend on insurance. The only thing is some guys pass out when they see a needle, so that's usually first line through insurance, but if they pass out when they see a needle, it may not be a good choice for them. But there's different ways. You don't really see the pill as often. There's been hit or miss on good evidence, and then in the previous, like 20 years ago, there was a question whether they caused liver cancer, so I usually don't do the pills. You just see gels. The downfall of the gels, though, same way with for also estrogen, there's always a risk of passing it on to your partner, so making sure it's, so for example, for the estrogen, I forgot to mention that if you did the estrogen gel cream vaginally, then making sure not to have sex on the day you use it, because then you can pass the estrogen on to your partner. Usually men will put it on their shoulders or the chest in the first thing in the morning, the testosterone and the androgel, and then they cover it up. No hugs, make sure they can wash their hands well, otherwise they can pass it on. Now, there are a lot of risks. One drawback, one thing we got to watch out for is polycythemia, where the the red blood cells are too high. And you think like, well, some athletes do that on purpose so they can do better with their cardiovascular workouts, but it can thicken the blood, and you worry about like that affecting the heart. So those are big things. You've got to stop it and hormone replacement therapy, or address what it is that's going on. So whether they have some condition that causes that, maybe they have sleep apnea, maybe they have some type of poorly controlled COPD, something that's causing them to have high red blood cells. Those are things you need to address first before you can do anything else. And of course, quitting smoking. And then, of course, there's a risk of gynecomastia. That's where men start having sensitive nipples whenever you talk about testosterone replacement. And that's because if it's so high, then there's a hormone that will convert your testosterone into estrogen. And that's in both people, called aromatase, and it'll convert it, so then their estrogen goes up. So there's always a risk of that. And of course, there's questionable whether there's some that disagree, a lot that do agree, the risk of prostate cancer with it. And the newest study, the largest study that just came out this last year, showed there was no increased risk of cardiovascular disease with testosterone. So, the importance of regular exercise and nutrition. I kind of emphasized this before. Same thing, 150 minutes of moderate intensity, 75 minutes of high intensity, lifting weights twice a week. It can be more, of course. You're absolutely welcome to do that more and continue to push yourself, but that's kind of the minimum. Where they also mentioned, another study had mentioned about making sure just getting 10,000 steps a day improve your risk of cardiovascular disease. Something, whatever it may look like, whatever will help you, because some of us may have to work 2 jobs, and that's okay. Then finding a way you can be able to stay active, just whatever that may look like for you. And then just there is some for the waist to hip ratio for guys as well, but again, because a lot of times we collect our fat more around here, around the waist, and so actually checking that would also help kind of determine our risk of heart disease and diabetes. And the one thing I just want to mention, again, especially it's men, we suck at like emotions sometimes, and then we just suck with stress reduction, because the idea that we got to be a lone ranger and we can do it by ourselves, pick ourselves up by the bootstraps, it's not healthy. And I just want to emphasize that. And I wish there was more of you guys here. I could be able to say that too, but it is what it is. And so getting the help, getting the support. It's kind of like, especially guys, we suck at having friends. We suck at talking about things. And so one thing I learned is that your wife can't be your best friend. They can't be everything for you. They can't be. You have to have some support from other guys. It's kind of like on Netflix, they had those blue zones. It showed one thing that everyone had. They had someone else, a friend that they could lean on as well. And those things were very important. And then, of course, getting regular checkups. Oh, and then I forgot to mention, regular checkups and being honest with your symptoms. That's the other thing I got to make sure to emphasize, especially for guys. You're it's easy to downplay it and say, I'm fine, nothing's going on, but there might actually be something. And it might be a problem. And so catching those things are going to be important, catching those early. So, in conclusion, same thing, catching these things early, just understanding what this is, and what is it we need to be doing about it. Mainly just making sure, taking care of yourself now so it doesn't become a problem later. Because like I said, when you wait for it to be a problem, it's going to be much harder to undo. Then you're just maintaining, as opposed to catching those things that are taking care of yourself now so that it doesn't become a problem. And then shameless plug for my group. But in the end, just finding something that you guys can do, that you enjoy, finding something that is where you can be able to push yourself to become better than yourself, the previous self. That's really the main focus. And so, yeah, and if your significant other wants to join, these are free as well. And it's all over the city. Any questions? Yes?
I've been hearing some about cortisol.
Yes,
And
it's a great question. Yeah, go ahead.
We'll expand on that.
Yeah. So here's the thing. So there's cortisol where I have my stress hormone that I release throughout the day. And there is the cortisol where it can be a big enough issue where it becomes Addison's disease. It can be Cushing's disease or syndrome. That's different. And so a lot of times when we talk about cortisol in the medical field, we talk about Cushing's disease and stuff like that, where someone has a tumor that releases too much ACTH from the brain or too much cortisol from the adrenal gland. And that's different than the cortisol levels that we have throughout the day. Now keep in mind, cortisol is your highest when you wake up. Boom, high shot as soon as you wake up. You're going in and out, waking up all the time, going up a lot. And then throughout the day, it ebbs and flows throughout the day. That's your stress response. You have too much cortisol throughout the day as a collective, it can weaken your immune system. It can make it difficult. It can be difficult to be able to lose weight. So again, that goes back to getting better sleep, not doom scrolling. Make sure you eat healthy food. Because you've had those days where you guys go out to eat on vacation and you're like, I just feel kind of gross because I ate out too much. So making sure to, there wouldn't be, in those ebbs and flows throughout the day because of my stress response, that's not something that you can block through medicine. You can reduce it by taking care of those things that we talked about. So that's exactly, there's a big difference between those two. So is that kind of what you were asking?
It addresses it. Some of the things I've heard, waking up at 2, 3 in the morning and having to go to the bathroom or just not being able to go back to sleep.
Yeah.
Is that
absolutely yes
has to do with cortisol?
So if you're waking up every 2 hours to go pee, it's too much. Yeah. Yes. And that also means new baby, you're waking up every 2 hours to feed them. Yeah. Cortisol level goes up. And yeah, that does make it difficult. And then your doctor's like, are you okay? You look rough. And it's like, I'm just trying to survive right now. What else? All right. Well, I appreciate your time. I'll be here if you guys have any other questions. Otherwise, hope it was helpful for you. Thank you.
How's your school?
I was also hoping you guys would recognize